We consider the amendments that were brought by the Senate. I will reiterate again that this is a substantive amendment, and we are confident in the piece of legislation that we put forward that was passed in the House of Commons, that we found the right balance, and this is the best approach for our country at this time in terms of medical assistance in dying.
So in order to address a complex piece of legislation like this, to find the appropriate balance so that people will have access to medical assistance in dying, as we know they must have, and at the same time protect vulnerable people, needs to be done in a thoughtful, proactive way. I am personally concerned about the lack of safeguards, and the extraction of the particular phrase and the amendment that was made last night raises concerns amongst vulnerable populations. I think in particular about people facing mental illness. The removal of the requirement for eligibility of natural death being reasonably foreseeable means that people with mental illness as a sole cause of their reason for seeking medical assistance in dying would potentially be eligible. It's going to be very difficult on the basis of simply a judicial process alone to ensure that people are appropriately protected.